Hi everyone, this is Hui, and I hope you're enjoying the first part of the pulse diagnosis, and this is the second level, midas touch, be a master of the pulse diagnosis. And someone just asked me how important the pulse diagnosis is, and does it really work? Because some people just said the pulse diagnosis is just not real, and they don't even need to feel the pulse. They can just ask all the symptoms, and then from the other method they can still have the right pathogenesis. But in fact, in the clinic, if you can understand the pulse diagnosis, and this is just another tool, and this is the manifestation of the imbalance of the yin and yang, and it just shows on the pulse. And so if you can understand this part, if you can find out the imbalance of the yin and yang in the pulse diagnosis, and you can have a better pathogenesis, you can have a better diagnosis. There are some cases that I want to share with you. The first one is I actually teach in a Chinese traditional Chinese institute in Calgary, and I'm supervising the clinic. So one day there is a student coming, and then she's having the flu or the cold for 1 week, and she had the typical wind cold symptoms. And when she described when the first time she got it, she had a very bad chills, but since after the first day, and then the chills gone, and she only had fever, but she has other typical wind cold symptoms like whole body's ache and a headache, stiff neck, itchy throat, running nose, and coughing. So they did the normal wind cold treatment, but this patient didn't get better. And then about 1 week later, when she came back, and then she said the symptoms wasn't relieved, and it's actually worse, especially the coughing. So when I saw her, her cough is deep, and then loud voice, and then dry, there's no phlegm coming out, and all the other symptoms almost the same. So they asked me, this is a very typical wind cold symptoms. Why when we did the normal wind cold treatment, it didn't get better, and then it's even worse? So I feel the pulse, and I just felt that on the right side swim position, it feels like still feels like floating, but when I push it downward, it's stronger, and this position is like very different from the others. So I asked the students, if this is just the wind cold, why does patient get worse cough, and why the cough is loud voice and then it's dry? And the students answered me that it's probably the cold is drifting the qi, and the qi of the nan, so the nan qi is wrapped inside, and then it's like rebelling upwards, so it's coughing. And then I further asked them, if it is from the cold, why the patient has a loud voice cough, and then why it is like rash and there's no phlegm coming out? And then they just like didn't know the answer. And after a while I told them, and if you feel the pulse on the non position, you can feel, if you push it downward a little bit, you can feel the pulse is pretty strong. It's like bonding. So what does that mean? If it is normal wind cold symptoms, the pulse should be floating and tight, and why the patient has the a stronger pulse when you press the twin position. So it's just because the external wind cold sometimes restrict the non-qi, and the non-qi cannot flow, so it just accumulates and starts to turn into fire. And the symptoms just supporting that is the patient has mouth voice cough and thrush, and also the pulse. When you press deeper, it's stronger, so that's just like early stage of the fire. And then because it's in the early stage, so the patient doesn't show that much heat signs. So it is the condition of the cold wrapping heat. So then I give the patient 9味羌活丸. That's a typical external cold and internal heat formula. So then the next week when the student came back, and she said it's better. Case 2 is an eczema patient, and this lady is around 70 years old, and she got the eczema on the chest for years. And when I saw her, the skin condition is like dry and scaly, and plus the color is dark red, and you can even see some like small veins on it. It looks like a spider vein. And then when you feel the pulse, it's just like wiry and slightly slippery. She's irritable, and all the symptoms, it looks like just like typical fire symptoms. But when I press deeper on this pulse, and it just feels like it's more running, or it's more like a beaming or harder in a deeper level. And then when I release it, and it's just like a slightly choppy. So I just decided this is not simply the fire symptom. It's because the patient has a long time fire, and then the fire really keep burning the blood level and burn the blood into the stasis, and then stasis combined with the fire and then accumulate and then turn into like the toxic. So that's why the skin condition doesn't look like very fresh fire burning condition. It's just like a dark and red. So for this condition, the students asked me if it is okay to use the 胃消毒饮, and I said no, and you should just like clear the fire, and at the same time you should remove the stasis, and not necessarily this is a blood stasis, but as long as there is a toxin, we should just move it, like remove it. So I used the 4秒永安汤, and that worked very well. And then just like 2 days after she took the first formula, the the eczema started to fan a lot. So after just like a week, all the skin almost, the condition almost like cured.